So, Gráinne, tell me what happened to your nails during treatment?
As treatment went on, I noticed that my nails were becoming more brittle. They were starting to flake and definitely were starting to discolour and lift away from my nail bed. I kept them really short, but I found they caught in things, and my nail beds were very, very sore, especially in the evening time, having been using my fingers all day.
And that's something we would recommend to people, is to keep your nails short during treatment, and also to use a nail oil to keep them nice and moist and hydrated.
When I came in here for my wig, the first day I was in here, I was so absolutely and utterly fascinated and upset about my hair that I didn't take the time. I wasn't in the place, I suppose, to take the time to look at all the other products that you have here, so that I could be more aware of the other side effects of chemotherapy and radiotherapy. Everyone seems to think about only their hair, and I can understand that, having lost my hair, but the other side effects can be just as traumatic, and if you're not ready for them, makes life very difficult. So nail oil I should have gone for, and thank you for pointing that out to me. I'll continue to use it from now on, though, because the symptoms have continued after the treatment has finished.
And that's a really good point as well. Like, prevention is better than cure, we believe. So to actually hydrate your nails before, during and after is the way to go. So you did it during the treatment and you stopped then quite early. You thought your chemo was finished and you could stop.
I did, and because I was so conscious of hygiene during treatment, I was constantly washing my hands, and every time I washed my hands I'd use my nail oil, I'd use moisturisers on my hands. But once I got to the end of the 3 weeks after my final treatment, I figured that once a day would be enough, and as I've learned to my detriment, it isn't, and really would advise anybody out there to continue.
So what we recommend is the Defiant Beauty Nail Oil by Jennifer Young. We would recommend you to put it on 3 times a day, before, during and after, probably for a month or two. And as you say, it's a really good practice for all of us to get into. The other thing you just mentioned about hygiene, so I just want to pick up on that point. Hygiene is really important during treatment because you do not want to pick up an infection, and that's why when we do manicures here, we don't cut the cuticle. It's really a file and polish, but we would also do like a little hand treatment, so we hydrate the skin. But be careful if you are going for a regular manicure during your treatment to be careful, maybe bring your own equipment, because you don't want to get any infection, cross infection, if you're going to a regular salon, and also never let them cut your cuticles. The other thing then that we would recommend is, if you are using nail varnish, to use a 5-free nail varnish, one that is free from toluene, DPD, formaldehyde, camphor and all the other nasties, and to always use an acetone-free nail varnish remover. Some of the hospitals do recommend using nail varnish to protect your nails, so that's quite good. And that's it.